But I think you probably clearly know who I am. The plan for this evening, for the third time, is thank you, KOM. I'm glad you can hear us now. Okay, well, nice to meet you all. Thank you for putting up with us with technology, my general ignorance, and speaking on the wrong channel. We're finally here, so thank you for your perseverance. In terms of, I think what we'll do is Adam and I will just introduce ourselves again, just in case you did or did not catch that. And then I will just answer the question that I was in the middle of answering. And then if you, Erica particularly, if you didn't hear the answer to your question that I answered a while ago, just let me know and I'm happy to readdress that. But please, I think from my point of view, I can talk a lot, as you will soon see when you get to meet me. But really this is about you making sure you're getting some of those unanswered questions that maybe I can't provide on the website. And Adam is here equally to help you with any questions about RGU, but also he has a great wealth of experience of visiting North America and dealing with students who are at that sort of considering application stage. So please feel free to ask, and this is really about as much information that you need to help support you at this application making stage. So I'm Julie Jones, I am the admissions tutor for the Masters Programme, and I'm one of the teaching staff here within the Faculty of Health and Social Care at Aberdeen.
And I am Adam Baxter, I'm Regional Manager for the USA and Canada. And as Julie says, what I'll be doing is taking some notes throughout this as well. So any questions you have, I will make the notes and make sure that Julie answers them when she's talking throughout the evening as well. So again, thanks for being patient. Any questions, feel free to email either Julie or myself.
Okay, I'm not sure if you can see all the questions. So Erica asked whether students who want to return to Canada have to take additional courses on the healthcare system in Canada. Okay, short answer, yes you do. It's a requirement of the Canadian Alliance that you have to undertake this course, and I believe it can be done online. Many of our students who are returning to Canada sit that course while they're here and manage to do it during their studies that they're here. Also, I run a module within the second year of the Masters Programme called Enhancing Physiotherapy Services, and this is very much where we look at the influence of healthcare policy and how it influences physiotherapy. So in terms of that, we look at global healthcare policy in the UK, and therefore we do touch on Canadian healthcare policy. But you, as a requisite, as a Canadian student going to work there, you will require to do that. I do believe there's a cost involved. I've sat the test myself. It's fairly straightforward. I have looked at trying to deliver it here as part of the course, but it's one of those requisites that the Canadian Alliance require you to do. So even though we've looked at building it into our programme, that's a tick box that you need to do with them, but it's fairly straightforward. Okay, so in terms of that, I think also therefore maybe Luke didn't also get his questions answered. Luke, I think, asked for questions.
Course content and workload.
Oh yes, thank you. Course content and workload. In terms of that, it is an intensive course. In terms of what you are doing, we also run an undergraduate physiotherapy programme here, which takes 4 years. So in terms of you're covering all that material within the 2 years. So it is an intensive course. So I am looking for people who can work under pressure and are good at time managing their workload. To give you a rough indication, the students who started in January 2015 are now on placement. So in that 16 weeks you're very busy getting all those prerequisite skills and knowledge and competencies delivered. But normally students are doing 2 modules a semester, and you're commonly in anywhere from 12 to 18 hours a week. That may not sound a huge amount, however in terms of that, for every hour that we deliver, we would expect you to do 2 hours yourself. So when you put that into the equation, it is a fairly full-time program. Perhaps maybe more so what you're trying to get me to answer is whether you can work while doing the course. I suppose with my very much academic head on, maternal head on, it would be ideal if you didn't work while you did the course, because it is fairly intensive. However, the reality of that is, yes, most of our students hold a part-time job. So I think that's the reality. I think something for you guys to be mindful of is when you're budgeting, because you'll be coming over here in a Tier 4 visa, you will be limited to be able to work, I think it's 20 hours a week. So in terms of that, which to me is more than enough, but in terms of that, that's something just to be mindful when you're thinking of budgeting for the programme. The other thing in terms of the work that you can do, it needs to be fairly flexible, because obviously you've got 6 clinical placements throughout the 2 years that you're here, and they are not always in Aberdeen. So for example, if we send you to Inverness for 6 weeks, you may not be able, you'll need to cease your employment while you're away for that time, but many of our students manage to get around that through sort of temporary jobs. Okay, so I think at the moment that's all the sort of questions that need answered, and so I'm just going to lull into my normal spiel that I do, but please feel free to interrupt me and I can answer any questions as you be able to go along. Okay, so in terms of that, so the admissions process, I would strongly recommend it if you're thinking of applying, then please do apply as soon as possible. I did notify KOM the other week that this year we are interviewing in country, and there is an interview process that we need to go through to consider appropriate applicants. So therefore, if you are thinking of applying, I would very much appreciate if you could get your application in before the 15th of July this year. The reason why I'm saying that, myself and a colleague are coming over to North America at the week beginning the 17th of August. So the reason why I've put down the 15th of July is I'm very, very mindful that if you're offered an interview, it's giving you a month to sort of organise your travel. Being very mindful of the distances that you guys have to cover, then I'm just wanting to try and keep those costs as minimal as possible. If you apply to me late in July, I may still look at it, as long as you're mindful that therefore you might have to make a late flight booking, and therefore that may be costly for you. So before I just answer a few of the questions that are coming up, in terms of that, a lot of questions I get around GPA. The minimal that we'll be looking at for me to consider an application is a 3. However, if you're accepted onto the programme, you'll see there's a broad variety of GPAs represented on the course. And that's really because I put a lot of emphasis on how people perform at interview. Because physiotherapist isn't necessarily about being the most knowledgeable, it's how you apply that knowledge in order to be able to treat your patients. A question here from one of the students here is there a possibility of deferring your position onto the physiotherapy programme? I think that is a possibility for you to do that, as long as you put that in your application form. So there's a little part of the application form that allows you to put additional information. And I think a deferral of a position is acceptable, as long as you've got some good reasoning for that. And the only thing that I ask is you keep in regular contact with me within that year, so I know, because I'm the person who has to juggle the numbers to make sure that I'm making sufficient offers. But that would certainly be something that I would consider for you. That's not a problem. In terms of that, is it a disadvantage if the professional reference is not a physio but someone you currently work for? No, that's not a problem at all. Generally, I would like an academic reference and an employer's reference. So in terms of, they are the two minimum ones that I would like. If there's any additional ones that you think that will strengthen your application, please feel free to put them in. Okay, so in terms of that, KOM has asked me to give an overview of the university, the programme and the city.
Maybe after the programme I can do the city and the
university.
Yeah,
I'll certainly that. Yeah, I'm kind of old and never really in the city, and I have no social life, so I can't really tell you what the city's like.
So at the end I'll get into that. If Julie talks about the programme some more now.
So in terms of this programme has been running for a number of years. The Masters Pre-Registration Physiotherapy programme has been running through for over 15 years now. So it's a very established programme, and it's been taking students from North America throughout that period of time. So in terms of that, this is not a new thing for us to be recruiting from Canada, and we are very adept and have a good working relationship with the Canadian Alliance. And I came over 2 years ago to sit with Canadian Alliance to look at how we can streamline that process and expedite a quicker transfer in order for you guys to sit your provincial exams and be accredited as a physical therapist over in Canada. So in terms of that, the programme is particularly well established. In terms of how the programme is run, the programme is run on a modular basis, and therefore you need to pass each particular module, and there's an assessment tied to each module. So there is no final exam, which is perhaps something that will come as a big relief to some of you who are used to the North American system of a final exam. So you have to be able to pass each module in order for you to be able to proceed. So in terms of that, we also run a spiral curriculum, and that really for me means that everything you learn in the first module will be expected you to keep that knowledge and be able to apply it to the next module. And every module has a build up in terms of expectation, in terms of knowledge. But equally within that, the model is very much a practical based curriculum. And that's really for we as physiotherapists, it's not so much, again, as I've already said, the knowledge, it's what you do with that knowledge. So the model is very much, you come in, we teach you stuff, we examine you, and then you go out on placement. You come back in, we teach you stuff, we examine you again, and then you go out on placement. So that model is repeated throughout the course, and you have 6 placements spread throughout the 2 years that you're with us. And that model of practicing on each other, practicing focusing on our volunteer patients who come in to be assessed by physio students, followed by placement, really helps with the consolidation of your knowledge and gets you to put those practical skills in. Now, we feel that as advantageous rather than waiting to the end of your programme and then suddenly you've got nearly a year of clinical placement. So the clinical placements range from between 5 and 6 weeks. They're also spread throughout Scotland. Now, we see that as advantage for a number of reasons. One, most of our Canadian students will tell us that's great because they get to see some nice parts of Scotland and get to travel Scotland while they're here. Our placements can be as far north as Orkney and Shetland, which is pretty much just south of Norway, as far as the Western Isles, but all the way down to the border with England, and really all stops in between. So within that, you get quite a variation in seeing the country, but what is more important for me is physiotherapy is delivered slightly differently in slightly different areas, and therefore you get a broad repertoire of skills and competencies as well as clinical areas. And in looking at our employment stats for physiotherapy within our course here, we're looking at 100% within 6 months, and part of that is because of the broad nature of the clinical placements that we provide for you here at RGU. And we have a designated member of staff who's responsible for organising those placements to ensure that you don't just come out with a musculoskeletal background. You'll have placements dealing with neurological patients, cardiorespiratory patients, older people, and placements within the community setting, as that's very much a new and evolving part of physiotherapy practice. So that profile is very, very popular and is one of the reasons why our employment statistics are so high. That said, it is something that you guys need to be mindful of is when you're budgeting for the programme, is that does mean that you may have to maintain accommodation here in Aberdeen or potentially funding accommodation for 6 weeks while you're in Inverness. So again, that's something for you guys to be mindful of, and that's for both international students but also our home students. So placements are integral, so you'll do a minimum of 1,000 hours of clinical time as part of the placement, and that is a mandatory requirement of our equivalent of the Canadian Alliance, which is the Healthcare Professions Council. So all physiotherapists need to do that 1,000 hours. So in terms of that, it's a considerable amount of practice that you will do, and that's purely your clinical time out in placement. That's not including the practical time that you'll have here within the university. So I've talked about it being a spiral curriculum. It's modular based. There's an assessment for each module and you're assessed on clinical placement. So the first semester that you're in with us for those 16 weeks is looking at Foundations of Physiotherapy Practice, where we look at key assessment skills for every peripheral joint and indeed the spine. We also, that module runs us alongside health improvement, where we're looking at exercise physiology, education. We're looking at health improvement theories and thinking about behavioural change models when we're looking at how we're going to manage our patients. In terms of that, it's probably a good moment for me to discuss the teaching ethos of our programme, and the fact that this is not a programme where I stand and talk at you for 2 hours and say, this is how you manage a trochanteric bursitis. That is not going to happen on this course. I'm not going to say this is how you treat a total knee replacement. This course very much has the ethos of a problem-solving approach to our teaching, where we're wanting you to be able to think about what the patient is in front of you and what are the best assessment tools to diagnose that person, but what are the best treatment. I suppose the common analogy I use with students is the fact you could have a total knee replacement who's 16 years old, who's got chronic juvenile arthritis that has a knee replacement. You could have a triple jumper who has competed at a high level and his knee is now severely degenerating and needs a knee replacement. And then you've got your 75-year-old older age person who needs a knee replacement. Now, though they may see the same consultant, may have the same operation on the same day, you need to problem solve what would you need, what is appropriate for that person, looking at their past medical history, their social history, their drug history, thinking about what stage they are in the life cycle. You wouldn't be giving each of those individual people exactly the same treatment based on their underlying condition. So this course very much is a blended approach to learning. We're using inquiry-based learning approaches, problem-based learning approaches. So my role as a tutor here in the programme isn't to tell you how to do it, it's very much to facilitate that learning and thinking about getting you to clinically reason what you're doing and why you're doing it, and what is the evidence to support what you're doing it. So those sort of individual strands are built throughout that programme. So by the time you get to the end of that 16-week period, we're going to assess you, and that we will be giving you a case study where you have to justify what you'd want to assess and why. You want to be able to suggest what treatments you're going to do and why, and that nicely prepares you for going on clinical placement. I'm just going to stop there. That's kind of taking you through the first semester of the programme, because I see I've been asked a question about, do students still need to provide a letter stating their overall GPA? I'm going to fudge this, so the answer is yes and no. If your institution can provide us with a confirmation of your final overall GPA, then I would very much appreciate that that goes with your application form. However, I think through working with KOM, it's come to our attention that that is difficult for a number of institutions in Canada, where commonly they do not give a final GPA, and therefore if your university is one of those, then that is not mandatory. I think if maybe I was to put that in context, we require that final GPA in terms of how we're audited by immigration. In fact, we need to make sure that we're evidencing that people have a cumulative GPA above that 3.0. So it's not, so do you want to?
Yeah, I was going to say what would be helpful is we have an online tool that can convert GPA into a final GPA. We appreciate if you can convert that, attach it to your application, then we'll verify it as well. I can't remember what it's called right now, but we can send it definitely to KOM, to the one that we use. So anything just help us out, that'd be great. But as Julie says, if your home institution provides it, great. If not, verify it online, and we'll check that as well.
I think what we do is we send you a link to a Gpa Calculator,
yeah.
And from that Gpa Calculator you need to type in the modules that you've done, and that calculator will calculate your GPA. So in terms of that, so you don't need to provide one from your institution, but we will ask you to calculate it and put it in, and then that's something that we verify for you. So hopefully that's removed that potential barrier that we're having. But in terms of that, it's an immigration thing that we need to satisfy that level that people have them. So unfortunately it's a mandatory thing that we need, but we've hopefully made that process easier for you. Now we've got the GPA calculator. Okay, so in terms of that, you're here with us for 16 weeks. We teach you all that stuff, we examine you, and then you go out on placement for 6 weeks. And then we do let you have some holidays. So Luke's question about how intense it is, you're pretty much in for over 20 weeks. And then we will then let you have 3 weeks of holiday. And I have to say, a number of our Canadian students do choose to go to Europe, because obviously it's so much cheaper for you to springboard into Europe rather than come from Canada. Okay, I see that KOM's just put a wee note up there. They will hold back offers until the GPA is provided. So that sounds good, and Adam will make sure that link is sent to KOM to make that easier. Sunday, Eric has also said, I had to take activity credits which were dismissed by Ontario Physio. Does RGU include them? Erica, maybe that'd be something that you could email me directly, or I'm not quite sure what you mean by activity credits. They certainly sound intriguing. Probably what I'd want to know is whether they were something that was included as part of your degree, or whether these were things that were extracurricular. I mean, if it's part of your undergraduate degree, then I probably will look at them, but if it's something extracurricular, to me that would be supporting evidence. So perhaps maybe email me that in particular, and you could always send me the transcript and I can give you that clarity on that particular answer for you. Okay, so in terms of that, I've got you through the first semester. You've been on placement. We give you 3 weeks holiday, and then you come back in and do our very creatively named module, Physiotherapy Practice 1, and this module very much focuses, right Erica, if it's mandatory for your degree, then yes, I would look at it. Okay, so in terms of that, you come in, do Physiotherapy Practice 1, where there's an emphasis on neurological management of our patients. So in terms of that, we look at everything from spinal cord injury to sort of your chronic degenerative to your acute cardiac type or vascular type neurological conditions. But again, in terms of that, what we're looking for then is again for you to, in terms of our teaching, I'll expect you guys to have done your self-directed study on what the areas of the brain are, what the functions of those parts of the brain, and my role then is to help you put that all together in terms of how is motor control controlled by the brain, and therefore if you've got a defect in one part of the brain, how is that going to affect movement, skill acquisition, and so forth. So in terms of that whole module is then looking at the basic assessments and thinking about how that toolkit of assessments would need to change based on the patient that you are having. KOM has just asked me, is there an acceptance deadline for those holding offers? if you have been made an offer, in terms of accepting that, I would like you to accept them as soon as you can. The absolute deadline for accepting those offers would be the end of October, because in November our admissions department are very keen to start processing visas, and therefore you have to have accepted your offer and paid your deposit by November, so that they can issue you with the CAS number. And the CAS number is very important because you'll need that in order to apply for your Tier 4 visa. I would like to say therefore it is the end of October. Admissions are very good at pulling out the stops for students who apply late. However, once it gets into December, UK does slow down for Christmas break, and the university is closed from pretty much the week of Christmas, and in Scotland we do like to celebrate New Year, so we don't come back to university, and the university is physically closed until I think this year about the 7th or the 5th of January. And to be honest, that is cutting it just a little bit too fine. So I'm going to say end of October you have to have accepted your offer, and that allows our support staff therefore to be able to support you through the all-important visa protocol. So that is really my cut-off, unless there's some exceptional circumstances around that.
Just say, of course, if you do hold an offer, then we can also put you in touch with current students. Julie's happy to chat as well, so if you have any questions about the offer that's maybe preventing you from accepting, then just get in touch and we'll help you out.
Yeah, my job very much at admissions is supporting you from this period on, and I would rather hear from students than you sit there and worried about things, and therefore I think when you speak to past graduates, I am your point of contact, so that, you know, if you experience any difficulties, let me know. I can only help with the problems that I know about, so in terms of that, the more open communication there is around that to support you getting there. Okay, so in terms of that, we've got, as far as the summer, we're doing neurology, and then as we move into the last part of the semester, we start looking at cardiorespiratory, again with a high emphasis on practical, looking at managing those from the acute stages right through to the later stages of those conditions. And of course, each of those are followed by a placement. So after that whole year, you'll have done musculoskeletal, you've done neurology, and you've done cardiorespiratory. So you've done those sort of core 3 main clinical areas, and then you're ready to start year 2. KOM has then just asked another question. Students are concerned seats will be filled by the end of October. It would be my hope that most of my offers would be out by the end of October for those considering January 2016 entrance. If people are wanting to be considered for 2017, as you know, KOM, we never entirely close the door. But in terms of that, because we'll be interviewing at the end of August, I would like to have oral North American applications done by the middle of July, so I've got time to review them. Yep, but just to reiterate that, I have put on our website, and I did speak with Martin last week about this, in terms of I would like all North American applications to be in by the 15th of July, because we are coming over on the week beginning the 17th of August to do those interviews. That gives me time to process them and offer interviews. If you apply after the 15th of July, I'm very happy to consider it, as long as you as an applicant are mindful that we are coming on the 17th of August, and that gives you a very, very short window to book yourself some time off work and to be able to get yourself to wherever we are to do those interviews. So in terms of that, it's not an absolute deadline, but as long as you're aware of what that position is. So yes, I would hope that all positions are firmed up really by the end of October, beginning of November, just because of the visa situation. Yeah. But obviously, as soon as we start moving into September, normally I'm starting to take applications for the following year as well. Alright, so in terms of that, I think we've got you through year 1. So in terms of that, to me, you have all those core skills. To me, the next module, Physiotherapy Pathways, that's the module that pulls it all together. So in terms of that, we're really wanting to challenge students' clinical reasoning and application of their learning. So a lot of scenario-based teaching. So you may have a young gentleman who's been in a road traffic accident, and he fell off his motorbike, and therefore he's got a broken leg, a punctured lung, and a head injury. So now he's got something neurological, cardiorespiratory, and orthopedic. How are you going to manage that? How are you going to prioritise that? And therefore, through that module, we use a lot of our Metiman, and you'll see clips of him within the Moodle sites, and that's our simulation learning, and therefore we can mock him up, and he breathes, he has a blood pressure, a heart rate, and therefore through our simulation techniques we can really challenge you in terms of those acute invasive techniques that we don't practice on each other clearly, but you will be practicing on them. She's showing you how to do intubation, how to do suction techniques as well as familiarise yourself with the different ventilatory modes as well. And then at that time you start your research project, and that often has a lot of interest in terms with our Canadian students about our research project. Students are given choice. We're all in favour of choice here, so students can either do a systematic review or they can actually do a data collection project. Now, while I'm saying there's choice, there's these research projects are often linked with the faculty members' current research interest, and therefore within that there's obviously, this year for example, all mine are on Parkinson's disease because that's my area of interest, but there's some on K-taping because that's part of another staff member's body of work, there's some work on ankle stability, there's some work on multiple sclerosis, there's some work on falls. So within that there's a range of different topics you can do, and students are asked to rate which 3 that they would like to do, and then we try and give everybody either their first or second choice. So they can, as I said, can be data collection projects or they can be systematic reviews, and you start that in the second semester, and that's a very long module that transfers throughout the whole of your second year of the programme. So you do pathways, then you go on placement, then you come back in, and then you do my module, which is clearly the best module of the course, where we're pulling it all together, looking at advanced practice, looking at what are the challenges for you guys as you're going to go out into the workplace. And really my module is very much focused at giving you those graduate skills that you're wanting to have. So within that, looking at personal development planning, business models, entrepreneurship, looking at business management models and thinking about how you could set up a business, evaluate businesses, evaluate services, and then thinking about policies and guidelines. What are the challenges you're going to face and what are the barriers you're going to face? And then you've got your research project to hand in, and then you finish on your elective placement. So wham bam, 2 years done very, very quickly, and it does pass very, very quickly. Okay, I'm just going to break from that topic for a minute. Somebody has just come online and asked me, how is the application assessed? Okay, I review all the application forms, and therefore what I'm looking for is I'm looking for a variety of different things within your application. I am looking for at your GPA, and I think perhaps what I've mentioned earlier, I'm looking for an absolute minimum of 3 for me to look at that. Anything below that, I'm likely to exclude it. But actually, to be honest, I just have a number of applications and I have to have some way of cutting out some of those. But I'm also wanting to look at what are the key qualities that I would expect for physio, and maybe what transferable skills or what experiences do you have that you could demonstrate that you've got that. So for example, communication skills is something that's very, very key to being a physiotherapist. You can see by how much I talk. So in terms of that, I'm looking for those sort of skills to come across within your application. If possible, I would like you to have physiotherapy experience or voluntary experience of working in a physio department or working with people, preferably across a variety of settings, so in outpatient clinics to working with people who are acutely unwell. I cannot make all that mandatory because I appreciate in Canada, due to some of the legislation, some of you can't get experience of working in an acute hospital, but at least some insight of knowing what physiotherapists do. There's reasons for that. One, I have several hats that I wear. I'm an admissions tutor, so obviously I want to make sure I'm getting people on the course who are interested in physio, but I am actually still a practicing physiotherapist as well, and I'm wanting to recruit the people who are going to look after me in my retirement, and obviously I've got investment in that as well. So I need to make sure that you guys know what you're letting yourself in for, that you have a good understanding of what physiotherapy is. And so for me, having an insight into the profession is key, because in terms of that, some of you may just think that you may want to work within the sports field, and while that is a very attractive and lucrative area of physiotherapy to work, in order to get a physiotherapy qualification, you've got to be prepared to work with children, you've got to be prepared to work with old people, people who are particularly unwell, and I need to make sure that you're mindful of that and aware of that and signed up to doing that, because you're investing both your time and indeed your finance to do that, and so therefore I do like people to have some volunteer work. Okay, but related field work would be great. I'm now preempting the next question will be, how many hours do I need to do? Again, I'm not necessarily counting hours, it's probably more the breadth of what I'm looking at. So in terms of, there's no minimum number of hours that I would be looking for. So that's what I'm looking for. I'm also looking for you in your application to have references, and again I think KOM will support you in terms of your references, but ideally I would like an academic reference and then one from an employer. A number of students are submitting several references to me, which is appreciated as well, and if you feel you've got additional references, additional certificates that would strengthen your application, please put that in. I suppose the personal statement is the bit that this year I found a variation in quality so far, the ones I've looked at. Your personal statement at the end is your opportunity to sell to me why you think you would make a good physiotherapist. Okay, so in terms of that, what have you learned about physiotherapy? What are the qualities of a physiotherapist, and how many of those do you have? Okay, so in terms of that, I put a lot of weight on that. So in terms of that, after I've looked at that application, if I feel it's strong enough, then you'll be invited for interview. And a lot of weight is put in the interview. As far as I'm concerned, you've got in there, you've got a foot in the door, it's up to you how you perform. And in terms of that, for me, physiotherapy is so much about the person, and therefore a lot of weighting is then put on how you perform at interview. What is the process for coming back to Canada? Okay, as I've already alluded to, we have a really good working relationship with the Canadian Alliance, and we have a number of students who go back each year. So in terms of that, RGU has a good working relationship with them at the Alliance, and we're in constant communication with them. We were mindful 2 years ago, because of how long it takes for the course to get accredited, that was a problem for our students returning back to Canada. So we have worked with the Canadian Alliance and moved our exam boards forwards. In short, what that means for you is that you will finish with us in December, and we will be able to provide you with transcripts to demonstrate that you've completed your master's degree. That means as soon as you return back to Canada at Christmas time, you can start that accreditation process. And essentially what that means, it takes the Canadian Alliance 12 weeks to process all your documentation, which we will compile for you, which is essentially everything you've been taught in paper format. And then from that, that means you can apply to sit your exams, which means now, as a result of us changing our assessment timetable, students are now able to sit the written component of their physiotherapy provincial exams in July, which means then that they can sit the practical component in September. Now, depending which province you choose to go back to, some provinces, I'm aware in Canada, that you can start working as a physiotherapist as soon as you've done your written paper. Other provinces, I believe you have to wait until you've done both components of the exam. Other provinces, I believe you just need to register for the exams and they'll let you work, but I'm sure you can work out potentially which provinces they will be. So in terms of that, our graduates therefore are sitting those exams within 6 months of finishing the programme. Yep. Okay. Equally, I suppose something that we've noticed this year, we have a number of Canadian graduates who are choosing to stay in the UK and have been very successful in getting employment in the UK, and a number of them stay here and work for a period of time while they're going through that accreditation process in Canada, and so they're getting that clinical experience. I suppose for me, just to be mindful of that, at the moment, Canadians who have a visa are eligible to work in the United States. You have, in Canada, in the UK. So if you're Canadian, you're eligible to work in the UK as long as you are under the age of 30 and you gain a full-time employment within 6 months of finishing the programme. So that is the requisites at the moment. But I do want just to be mindful of that in terms of that is a UK immigration rule. And if you're to start with us in January 2016, unfortunately I have no powers over whether that would change in the next 2 years. Now we've just had a change, well not a change in government, but the government has just been re-elected, but I couldn't say how policy may change. But that is an option, and a number of our students this year have chosen to stay in the UK and work within the National Health Service, so you may wish to do that. Will we require further clinical hours from Canada? No, you will not. So we've sorted that out with a relationship with the Canadian Alliance. We're mindful that you guys need to have a set number of neurological hours, a set number of cardiorespiratory hours, and a set number of musculoskeletal hours. So when I mentioned earlier that we work hard to make sure you've got a profile, particularly with our Canadian applicants, therefore we do make sure that you've done those hours. So we either match those or we exceed those hours for you, so there's no further work that you therefore need to do in terms of clinical experience. So in terms of that, I think that hopefully that maybe evidences to you how many Canadian students we have and how aware we are of what's happening in Canada. And indeed, and certainly I've started talks with the Canadian Alliance 2 years about getting our course accredited in Canada. And certainly that's something I'm constantly always emailing. Well, at the moment, they're not wanting to accredit any courses outside because they feel the process of now processing RGU graduates is so quick that they don't necessarily the accreditation would add anymore. But it does demonstrate that sort of our commitment to sort of looking after our Canadian students. So the other thing I think that Adam mentioned on one of our broadcasts that we've done tonight, and I don't know if it's the one that you've heard, if you'd like to get into some sort of communication with some of our Canadian students, please feel free to email me letting me know that you're happy for me to forward your email across. I think in our current cohort that we have in first year, 70% of them are from North America and 2/3 of them are from Canada. So in terms of that, I've got an eager group of students that are very happy to talk about their experiences of coming to the UK, studying in Aberdeen. So in terms of that's something that I'm happy to do. So KOM will be able to give you my email address, or it's on the website, and I'm happy to help you with that. I'm just going to pause for a minute because I think KOM had also asked to talk about the city. So I will hand that over to Adam.
Yeah, oh, perfect. Thanks, Julie. So just really quickly about the city itself. First of all, I have to tell from my accent, I'm actually English, I'm not Scottish, but I moved up here last year. It's a great place to live. It's you'll please see the map. It's quite high up in Scotland, northern Scotland, about 2 hours north of Edinburgh. So you might think there's not much going on, but there's so much, because one of the main reasons is we're the oil and gas capital of Europe. So we're a very rich, international, vibrant city. So lots of coming and going, lots of great restaurants, things to do, events, especially in the summer months as well. What's great in the summer as well, the sun hardly ever sets as well. It does mean the winter's a little bit darker, it gets a bit colder, but I was in Toronto a few months ago and it's very cold there, so it might be really cold in Canada sometimes. So really welcoming city as well. It's about 200,000 people and quite a big uni town. So we have the University of Aberdeen and Robert Gordon. So it makes about 25,000 students in the city. So quite a good number of fellow students from all courses as well. At RGU, so we have the health sciences, we also have the business school, and we have design and tech. So you're going to be mixing with lots of people in your accommodation on campus, for example. The city itself, we have a beach in the city about 20 minutes from the city centre. The campus, by the way, is in the south of Aberdeen, about a 15-minute bus ride or a cycle ride as well. And what's great about Aberdeen is so accessible to get to the Highlands, for example, or the mountains, or again, Glasgow, Edinburgh, Inverness, Dundee, other great cities in Scotland. So it's a really great base to learn and to travel the rest of Scotland and Julie mentioned Europe. So any further questions about that, then feel free to get in touch with me. The accommodation, incidentally, we have accommodation on campus, but a lot of our students tend to live in the city centre, so you get the best of both worlds. You get to experience the city life in the centre of Aberdeen, and then come to the beautiful campus on the riverside, really green campus, excellent facilities. Julie's mentioned the Mediman already, which I only saw the first time last month, and it's incredible. Honestly, our facilities here are really state of the art, and it's the emphasis is on the practical element, vocational element, to get you not just the academic experience, but also that hands-on experience that employers look for. So a great city. I'm really enjoying myself here, and as I say, get in touch. We can put you in touch with current students from North America, and they're the ones I know will really sell the city as well. They're very honest, our students as well, so they'll tell it as it is. So yeah, that's something that we definitely look for you. Go on to the RGU pages, so rgu.ac.uk/Canada. You'll see links on there to current student profiles and links to my details as well, so feel free to get in touch with me as well.
Okay, accommodation is something that a number of students ask. A number of students tend to stay in RGU accommodation for the first 6 months that they're with us, just while they're settling in, getting to know Scotland and just finding out where they want to live. And then quite often after that, they then move into sort of a private lease, as Adam said, either in the city centre or here on Garty, so they can roll out of bed and come onto campus. So in terms of that, there is a lot of sharing of accommodation within the programme, also between the programmes in terms of the year 1 and year 2 of the programmes. Within that, there's also that relationship, and also a number of our students, we do attract a lot of people from a sporting background, so through the sporting societies that there is at the university, then that is also something that you build a lot of buddies through that programme as well. We do try and integrate our teaching from the master's programme with the other physiotherapy groups that we have here on the undergrad programme, and also at times we are trying to incorporate some of your teaching with the occupational therapists and the diagnostic radiographers as well. So in terms of that, you do get to meet that broader sphere of clients and other students around. Unfortunately, there is no Tim Hortons really in the UK, which is the main question I get asked from Canadian students recently.
Although I think Tim Hortons and Burger King have just formed an alliance, so possibly in the near future. Who knows? Who knows?
But we are well supplied and versed with Starbucks. In fact, there's a Starbucks on campus. So in terms of that, for those, but most of our Canadian students go back in some degree of mourning for some Tim Hortons. But I'm sure with the number of students going back and forth across the water, the odd donut could be smuggled in from time to time. I was amazed. We were in Canada in April, and a lady had actually bought a 24 box of donuts, and she flew them back to the UK. That was on my flight. I was amazed. I mean, I know the donuts are good, but I didn't think they were so good that one had to bring a carry-out back from Canada. I just want to know, there's maybe a couple of tiny little bits that I maybe wanted to say, but in terms of that, I'm mindful that we've been online for about 40 minutes or so, and I'd be interested to know if you've got any other questions. If not, we'll probably wrap it up in the next sort of 5 minutes. The only other thing I wanted to talk about was assessment. The assessment is very varied, and again, I can't remember if it was in this particular broadcast or when I was broadcasting to nobody, was whether the assessment here is modular based, and there's a range of different assessments. So there's a mixture of practical exams. There's also written courseworks, generally somewhere between 3,000 and 5,000 words for a 15 credit module. There's also presentations that are also integrated, and that's part of us trying to get you those sort of graduate skills that you're going to require when you're in the workplace. And you're also therefore continually assessed on clinical placement as well. So in terms of that, we feel that with that broad mixture of practical, written, report writing, as well as your dissertation in your final year, hopefully there's something for you to excel at each one, because each one will lend itself to a different sort of learning approach. You'll be supported through having a personal academic tutor, so each member of staff has assigned a number of students, but indeed, in terms of that, we're quite a friendly group in the fact that I'm not bothered if I'm your personal tutor and you don't feel that you're happy to talk to that about me. I'm really just happy as long as you speak to somebody about it. In terms of that, because we're quite a small cohort that we'll be looking to recruit, I'm looking to recruit somewhere between 26 and 30 students. I think it's a good thing, because if you're not in, I will know that you're not in. You may not think that is good because there's no place for you to hide, but in terms of that, we have a very, very good rapport with our students. I know who they are, and particularly me as admissions tutor, because I get to know them, we get to know you guys before you come. But in terms of that, it's a very friendly community setting, and I think because there is so many mixed cultures within the course and indeed the university, it's not something that you're certainly not going to feel alone with. I don't really necessarily have an awful lot to add. I've kind of covered the course, I've covered admissions, assessment. Placement I've also covered, in the fact we cover the length and breadth of Scotland. So in terms of that, I would just like to apologise again for the technological issues at the beginning. I was here at 5 o'clock, I can justify that I was. However, obviously I was just broadcasting over the wrong channel, which should not be reflective of RGU, just me. And you'll see that when I come. I'm a little bit scatty sometimes. So in terms of that, thank you very much for being here tonight, and I really would welcome you to ask any questions that you have after today's session. If it's particularly about the course, please feel free to direct them. Things around studying in Aberdeen, international based questions, Adam or myself can help you with that and be able to point you in the direction. And we're happy to say either to pass you some of your queries on to our alumni that are back and working in Canada, and indeed I visited a few of them when I was last out there, so we're still in touch with them, or I can put you in touch with some of our current students as well. So all I really want to say is please bring on your applications. I'm very happy to look at them. If there's any particular queries that maybe you're slightly unique in your application process, we do take a very individualised approach to them, and we are mindful that people have maybe had a slightly different journey through university. So any questions, please just feel free to ask, and we're happy to help.
Absolutely. Just to reiterate as well, so I've asked Julie, but Julie's great, and the rest of the team, it's a really friendly team, but also great experience, know what they're doing, and it's just about the scholarship actually really quickly. So we do also have internal scholarships. We have sole hire scholarships you can apply for, and that's why we do recommend that if you are going to apply, then do use KOM consultants. They're a recommended agent, and they have great experience too, and they can definitely advise on application, on scholarships, and they're in touch with us every week almost. So again, use them as your way in, and just say again, best of luck. Fingers crossed indeed.
Yes, fingers crossed. Good.
Thanks for joining us, and hopefully see you soon.
Okay, thanks very much, and see you later, guys.
Cool. Good night.
Bye.